Colorectal cancer is the second leading cause of cancer deaths in the United States. More than 158,000 new cases are diagnosed every year, and over 55,000 people die from it annually. Those numbers are not going down. Among adults under 50, rates have been rising steadily for decades, and the trend is accelerating in people in their 20s and 30s in ways that have caught the medical community off guard. And yet colorectal cancer remains one of the most preventable and most treatable cancers that exists when it is caught early. The survival rate for colorectal cancer detected at the localized stage before it has spread is over 90%. When it is caught after it has spread to distant organs, that number drops to around 13%. The gap between those two outcomes comes down almost entirely to one thing: whether the warning signs were recognized and acted on in time. That is what this video is about. The reason colorectal cancer is so frequently missed in its early stages comes down to a combination of factors that are worth understanding explicitly. The first is that many colorectal cancers, particularly in their early stages, produce no symptoms at all. The Mayo Clinic states this directly. Many people with colon cancer do not have symptoms at first. A tumor can grow in the colon or rectum for months or years before it produces any sensation or visible change that would prompt someone to seek medical attention. By the time symptoms do appear, the cancer has often progressed beyond the stage where treatment is most effective. The second factor is that when symptoms do appear, they are frequently dismissed as something less serious. The warning signs of colorectal cancer overlap significantly with extremely common and benign conditions. Hemorrhoids cause rectal bleeding. Irritable bowel syndrome causes changes in bowel habits, cramping, and gas. Food intolerances cause bloating and discomfort. Fatigue is attributed to stress, poor sleep, or a busy lifestyle. The problem is not that people ignore dramatic symptoms. It is that the symptoms of colorectal cancer often look exactly like the things people routinely explain away. The first and most important symptom to understand is rectal bleeding or blood in the stool. This is the symptom most strongly associated with colorectal cancer in research and the one most often dismissed as hemorrhoids without further investigation. Blood in the stool can appear as bright red blood visible in the toilet bowl or on toilet paper, or it can appear as dark, tarry stools, which indicates bleeding higher up in the digestive tract. Any blood in the stool that is unexplained, persistent, or accompanied by other symptoms warrants medical evaluation. The assumption that it is hemorrhoids may be correct, but confirming that assumption is worth the conversation with a doctor. Changes in bowel habits are the second major category of warning signs. This includes persistent diarrhea, persistent constipation, or a shift in the consistency of stools that lasts for more than a few days and does not resolve on its own. The operative word is persistent. Everyone has occasional digestive disruption. What colorectal cancer produces is a change that does not go back to normal, reflecting the fact that a tumor is physically altering how the bowel functions. Narrow or pencil-thin stools, where the stool appears significantly thinner than usual, can indicate that a tumor is narrowing the passage in the lower colon or rectum. The sensation that the bowel has not fully emptied after a bowel movement is another symptom that deserves attention. This feeling, sometimes described as incomplete evacuation, happens when a tumor is present in the rectum and the body interprets it as stool that has not passed. It is easy to dismiss as a digestive quirk, particularly when it is not accompanied by pain. But when it persists or recurs regularly, it is a recognized warning sign. Ongoing abdominal discomfort is the fourth category. This includes persistent cramping, gas, bloating, or pain in the abdominal area that does not have an obvious cause and does not resolve. The distinction here is between occasional digestive discomfort, which is normal, and discomfort that keeps returning or is consistently present over weeks. When abdominal symptoms occur alongside any of the other warning signs on this list, the combination is more significant than any individual symptom alone. Unexplained weight loss and unexplained fatigue are the systemic symptoms that often indicate more advanced disease. Losing weight without trying, particularly when no change in diet or activity explains it, is one of the body's signals that something is consuming energy and resources that would otherwise go toward maintaining normal body weight. Persistent fatigue that is out of proportion to a person's activity level and sleep can result from anemia caused by slow, chronic bleeding from a tumor that has been going undetected. Because the bleeding may be microscopic, meaning not visible to the naked eye, a person may be losing blood regularly without ever seeing it, and the resulting anemia creates a tiredness that sleep does not resolve. Screening is the tool that catches colorectal cancer before symptoms develop, and the current guidelines make it accessible for most adults. The CDC, the American Cancer Society, and the U.S. Preventive Services Task Force all recommend regular colorectal cancer screening for adults at average risk beginning at age 45 and continuing through age 75. The options range from annual stool-based tests, which can be done at home and are non-invasive, to a colonoscopy every 10 years, which allows direct visualization of the colon and removal of precancerous polyps before they become cancer. The colonoscopy is considered the most comprehensive option because it both detects and removes polyps during the same procedure, effectively interrupting the progression from polyp to cancer before it occurs. Certain groups need to begin screening earlier than 45 or screen more frequently than average. People with inflammatory bowel disease, including Crohn's disease or ulcerative colitis, face elevated colorectal cancer risk and should discuss earlier and more frequent screening with their gastroenterologist. People with a personal or family history of colorectal cancer or colorectal polyps need earlier and more frequent screening because both genetic and shared environmental factors elevate risk significantly. People with specific genetic syndromes, including familial adenomatous polyposis, known as FAP, or Lynch syndrome, which is also called hereditary non-polyposis colorectal cancer, need individualized surveillance plans that often begin in adolescence or early adulthood. If a first-degree relative, meaning a parent, sibling, or child, was diagnosed with colorectal cancer before age 60, the general recommendation is to begin screening at age 40 or 10 years before the age at which that relative was diagnosed, whichever comes first. The rise in colorectal cancer among adults under 50 is the part of this story that makes the warning signs particularly relevant for people who may feel they are too young to worry about this disease. In the United States, adults born around 1990 have roughly twice the risk of colon cancer and 4 times the risk of rectal cancer compared to adults born around 1950 at the same age. Researchers are still working to fully understand the causes, and as covered in another video on this channel, the gut toxin colobactin produced by certain strains of E. coli is emerging as a significant contributor. What is clear is that young adults with persistent symptoms cannot assume that age makes colorectal cancer unlikely. It is not unlikely. It is happening with increasing frequency in exactly that age group. The conversation about colorectal cancer symptoms is uncomfortable for most people. It involves discussing bodily functions and changes that most people are conditioned to keep private. That discomfort has a real cost. Delayed diagnosis is one of the primary reasons colorectal cancer deaths occur in cases where earlier detection could have changed the outcome. A symptom that seemed too minor to mention, or too embarrassing to bring up, or too easy to attribute to something else becomes the missed window. The information in this video does not require action from anyone who has no symptoms and is current with recommended screening. But for anyone who has been experiencing any of the symptoms described here for more than a few weeks without a clear explanation, the right response is a conversation with a doctor. Not next month. Now. There is someone in your life who needs to see this. The share button is right